Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about celiac disease. So, as regards celiac disease, its symptoms may be non-specific. Sometimes abdominal distension, sometimes diarrhea, constipation, malabsorption, sometimes weight loss, dermatitis herpetiformis. All this may appear in the patient of celiac disease. But sometimes complications appear, like iron deficiency anemia, osteoporosis, infertility, sometimes cancers, neurological problems, and other autoimmune diseases. It may appear at any age. As regards the duration, it is lifelong disease. As regards risk factors, there is genetic predisposition, type 1 diabetes, sometimes autoimmune thyroid disease, maybe some syndromes like Down syndromes or Turner syndrome. How to diagnose this disease? From family history, blood antibody tests, intestinal biopsies, genetic disease testing, response to gluten withdrawal. So, what is the differential diagnosis of celiac disease? Inflammatory bowel disease, intestinal parasites, irritable bowel syndromes, cystic fibrosis. What about the treatment? Gluten-free diet. This is the only treatment. So, as regards this disease, celiac disease is a long-term autoimmune disorder. Primarily affects the small intestine, where individuals develop intolerance to gluten, present in foods such wheat, rye, and barley. Classic symptoms include gastrointestinal problems such as chronic diarrhea, abdominal distension, malabsorption, loss of appetite, and among children, failure to grow normally. This often begins between 6 months and 2 years of age, but sometimes this disease comes at any age. Non-classic symptoms are more common, especially in people older than 2 years. There may be mild or absent gastrointestinal symptoms, a wide number of symptoms involving any part of the body, or no obvious symptoms. Celiac disease was first described in childhood. However, it may develop at any age. It is associated with other autoimmune disease such as type 1 diabetes mellitus and Hashimoto thyroiditis. Celiac disease is caused by a reaction to gluten, a group of various proteins found in wheat and in other grains such as barley and rye. Moderate quantities of oats free of contamination with other gluten-containing grains are usually tolerated. The occurrence of problems may depend on the variety of oats. As regards the disease, diagnosis is typically made by combination of blood antibody tests and intestinal biopsies, helped by specific genetic testing. Making the diagnosis is not always straightforward. About 10% of the time, the autoantibodies in the blood are negatives, and many people have only minor intestinal changes with normal villi. People may have severe symptoms and they may be investigated for years before diagnosis is achieved. Increasingly, the diagnosis is being made in people without symptoms. Evidence regarding the effects of screening, however, is not sufficient to determine its usefulness. While the disease is caused by permanent intolerance to gluten proteins, it is distinct from wheat allergy, which is much more rare. The only known effective treatment is a strict lifelong gluten-free diet, which leads to recovery of the intestinal lining, the mucous membranes, improves symptoms, and reduces the risk of developing complications in most people. If untreated, it may result in cancers such as intestinal lymphoma and slightly increased risk of early death. As regards this disease, as regards signs and symptoms, it may be gastrointestinal problems and also malabsorption related problems. As regards the disease diagnosis, it depends on blood tests, endoscopy, and examination of intestinal mucous membrane and other diagnostic tests. As regards the gluten withdrawal, this will improve the condition. As regards the disease, the classic symptoms of untreated celiac disease include pale, loose, or greasy stools, which is called steatorrhea, and weight loss or failure to gain weight. Other common symptoms may be subtle or primarily occur in organs other than bowel itself. It is also possible to have celiac disease without any of the classic symptoms at all. This has been shown to comprise at least 43% of the presentation in children. Further, many adults with subtle disease may only present with fatigue, anemia, or low bone mass. Many undiagnosed individuals who consider themselves asymptomatic are in fact not, but rather have become accustomed to living in a state of chronically compromised health. Indeed, after starting gluten-free diet and subsequent improvement becomes evident, such individuals are often able to retrospectively recall and recognize prior symptoms of their untreated disease that they had mistakenly ignored. Thank you very much.